This is SiriusXM Doctor Radio.
And now, from the heart of the NYU Langone Medical Center, this is Doctor Radio Coronavirus. What you need to know now. Here is your host, Dr. Marc Siegel.
Let's go to the phones. Thanks for waiting so long. Anne from Florida, what's your question for Dr. Francois?
Yes, my husband and I are planning a trip from Florida home to Maryland. And we're wondering about the hotel rooms, if they're safe.
Good question.
Yeah, it's a great question, and I've gotten that question from a number of individuals. And what I have said to them is that the advice that you've heard, which would be very, very important to follow, includes to make sure that during your travel that you are paying attention to hand hygiene and washing your hands thoroughly, or if you don't have at the moment access to water, just those hand sanitizers actually do work. When you get into and also in terms of if you see someone who's coughing, the maintaining distance from that individual can help. Certainly helps. In the hotel room, that if you have the wipes, that there are certain common air places that you want to, like the counters that you want to wipe down, that is also very helpful. And even doing something as simple as using napkins to open the handles or the button on the elevator. These simple things actually are helpful.
Fritz, what are your thoughts about all of the hand sanitizers? I'll tell you what mine are, and I'll see if you disagree. There's a lot of controversy about them right now because people say they've never been proven to work. But I think a coronavirus is pretty easy to kill, and I think they're probably okay.
You're right, but based on everything that we know so far, Mark, it is a pretty weak virus. What I mean by that is that the things that we use, like those Purells, those alcohol-based products, will kill it. And so it is important for people actually to recognize that and use them. It makes a difference in terms of trying to control the spread of this thing.
Let's go on to Bill in New Jersey. Welcome to Dr. Radio Reports. We're talking coronavirus. What's your question for Dr. Francois?
Dr. Siegel, Dr. Francois, greetings.
Greetings.
Here's my question. I just stopped for gas up in Connecticut when I was driving from Rhode Island. I got gas and went in for a bathroom break. And you wash your hands. I washed them twice with soap twice. And then I went over, and there are no towels, so you've got an air dryer, one of those Dyson type of air dryers. What I've heard in the past is sometimes those air dryers, especially if someone hasn't washed their hands very well, they're leaving droplets on the ground or in the air. And so somebody gets in, they wash quick or don't even care about soap, and then they use the dryer because their hands are wet. And aren't they spreading the droplets of this possible virus into the air for those who are also in the house, so to speak, in the bathroom?
The most important thing and I will congratulate you for saying this, is that you are engaged in hand hygiene. You are washing your hands. And that's really the most important thing there, because the reality is that, you've seen that the individuals who aren't doing that really are contributing to the potential spread. As far as those particular dryers, they are effective in terms of drying your hands. And if you've done this well in terms of using soap and water, I will tell you that there are things that are even more robust than the coronavirus that you will kill. Like you will be able to get them off your hands and also kill them. So that actually is the most important message.